Senior correspondent Sharon Ijasan joins me on the news from the States. Sharon, you visited some of the hospitals affected by the strike. What was the physical atmosphere like on the ground? Were there patients waiting, security presence or total shutdowns?
Well, from my observation, it was a total shutdown. Typically, the way patients do visit public hospitals, it's more subscribed to than the private hospitals. Visiting the public hospital for the last few days, my observation is most patients did not even take that initiative to go to the hospitals. The hospital wards were deserted. Visiting some of the rooms, you would see empty chairs. Just skeletal services is what is being offered. Most of the times, most of the hospitals I visited, the accident and emergency unit is the only one that is operating. At the Lagos University Teaching Hospital, Luz Idiaraba, the maternity ward was operating during my visit yesterday, and today it's still operating, but most of the other wards are not working up to capacity. And definitely there are some of the patients that came in that are outpatients that were not aware of the strike. And of course, you would see the disappointment on their face, thinking that they would be able to meet up with a healthcare professional to attend to them.
So JOHESU insists the strike will continue unless government commit to the new salary structure in writing. What exactly is the point of disagreement? Is it the financial implication, the implementation timeline, or distrust based on past promises?
First, the health workers wouldn't want to say it's a new salary structure that they are demanding for. What they are demanding for is for the government to approve the new salary adjustment as a result of previous negotiations that have actually happened before now. Now, you would recall that the Joint Health Workers Union embarked on industrial action last year in October, and it was a 7-day warning strike. For them, it's important for the government to approve the Presidential Committee on Salary and Wages. They want them to approve the report of the high-level committee that had been set up since 2021. So this salary adjustment they are seeking for has been at the fourth burner since 2021. They were able to come up with a conclusion in 2022, and it was presented to the government. So one thing you would want to understand with me is that government is continuous. So it's not about this particular administration, it's about the negotiation that has been ongoing before now, even since 2014. Yeah. So the breakdown in communication started in 2014. That's and right. They were able to meet up in 2017. They were able to come up with a document in 2021. Right, and in 2022, they presented the document. So they want the federal government to, as a matter of urgency, come up with a secular and an implementation table for them to return back to work.
Right. Senior correspondent Sharon Ijasan live for us there. Thank you.